my name is Dr. Shaun Patel, and I am a physician at Miami Skin and Vein in Coral Gables, Florida. Today we've got a Iris from our staff to volunteer for a bunny line injection. I'm actually going to inject Botox into her bunny lines, her nasalis muscle, to correct bunny lines, a common problem that we see in many of our patients. Iris is going to right now demonstrate for you the activity of the nasalis muscle. Iris, can you frown for me? And you can see right here, you can see the bunny lines. These are the classic bunny lines. Iris has, of note, received 40 units of Botox to her forehead, her glabella, and her lateral canthal lines recently, about 3 weeks prior. And now I'm going to go ahead and treat the nasalis muscle and the bunny lines on camera for you guys to see. A couple of interesting points that I'd like to make about the nasalis and the bunny lines. What I've noticed is when I'm injecting the glabellar complex and when I'm injecting in this region, the procerus and the corrugator muscles, I notice that once those muscles are paralyzed, relaxed, we see that the body will oftentimes get the nasalis to recruit the nasalis, and you'll see worsening of the bunny lines in patients who do have bunny lines. I've also read that about 10% of patients are dependent on the nasalis, or the nasalis in 10% of patients functions as a brow depressor, almost essentially a part of the glabellar complex. So in those patients, obviously if you treat the glabella, you may get some increased activity in the nasalis. And so in those patients, I do like to go ahead and treat the nasalis at the time of glabellar injection. Anatomically, the bunny line injection is a pretty simple injection. I usually use anywhere from 6 to 9 units, 3 different injection points, which I'll demonstrate to you. Thing that you guys need to be careful of when doing a nasalis injection is that there are very important lip elevators right at the nose-cheek groove, nose-cheek junction. Right here sits the Alicia nasi, and so when you are injecting the nasalis, you want to make sure you are positioned away from that muscle, not at the groove, because Botox diffusion into that muscle can result in a lip droop. And so that's really one of the only things that you need to be careful of with this injection. Things that are also important, I like to tell the patients that this is an injection that hurts a little bit more than injections elsewhere in the glabella. I've noticed that with my patients, and I just warn them. It's still a very quick injection, and most patients tolerate it amazingly well. So without any further ado, we're going to go ahead with the injection on Iris. I would like to thank Iris for volunteering for this video. Alright, so we're going to get started with the injection. As we always do, we will clean the area that's going to be injected with alcohol. And obviously, before any cosmetic procedure, at least we here at Miami Skin and Vein like to take a good set of before photos, which were taken, which will be available for you to see on our website. We're just cleaning up the nose with some alcohol. And then my assistant here, Karina, is going to help me out. So this is 4 units of Botox right here. I'm going to ask her to frown. And you can see that nasalis right there. And what I like to do, relax. Relax before injection. And right into the body of the muscle right here, 2 units. Great. And then I'm going to have her turn, frown again for me. So you just go right, relax. Have the body of the muscle right here. And right into the lines there. Perfect. Iris is not bleeding at all. She's a great patient. Right. I'm going to turn her head again. Frown again for me. Relax. I'm going to go right into the body of this muscle right here. So we did 3 injections. 1 central in the muscle. So the muscle actually, the nasalis runs like this. And so like this, this, this. And so I did 1 right in the central aspect of the muscle, 1 right here, and 1 right here. If you don't know where to inject, all you have to do is ask her to make a frown for me, and you can see right into the body of the muscle. So pretty easy injection. As you can see, the patient tolerated it very well. And in about 7 to 14 days, like with any other injection, she won't have any more bunny lines and she will be very happy.